Hello everyone, this is Dr. Kendra Campbell. I'm a psychiatrist and the founder of Free Range Psychiatry. And today I'm going to talk to you about the right and the wrong way to take off a mask. So recently the CDC has updated their recommendations, and they're now recommending that if you have to go out into a public area where you're likely to have contact with other people, that you wear a cloth mask. Now, the key word there is have to. So still the recommendation is, if you do not have to go out, please do not. Please stay home. The number one best thing that you can do to protect yourself and your family is to stay home. However, if you are an essential employee, or if you must get groceries or medications or something like that, and you have to go out in public, then yes, you can consider, wearing the cloth mask or a surgical mask. So, but there's some important things to know about that. So one thing to keep in mind is that surgical masks and cloth masks, here's an example one right here, were never meant to kind of protect the person wearing the mask, but they're meant to protect other people. So here's an example. If I was wearing this mask and I sneeze, all those yucky bacteria and germs would hopefully get stuck right here, instead of going out into the air and then spreading the virus and germs to other people. Now, as far as the mask actually protecting the person who's wearing it, it's a little fuzzy. So there's some evidence that it could offer some protection, but then there was also a really large study that found that when they looked at healthcare workers who were wearing cloth masks, they actually found that they were more likely to get ill if they were wearing the cloth mask. One thing that could be affecting that is whether or not they were wearing them properly. So if you are improperly wearing a surgical mask or a cloth mask, you are definitely potentially increasing your chances of getting sick or contracting a viral illness. So I'm going to explain that to you and show you how that would happen. Here's how you would properly wear a cloth mask. The first thing you would do, I don't have a sink with me, but the first thing I would do, I'm using some hand sanitizer, but ideally would be to wash my hands with soap and water for at least 20 seconds. Now that my hands are clean, I'm going to pick up my mask, okay? And you can pretend like this is a cloth mask. This is actually a surgical mask. So the first thing to notice is that this one is blue on the outside and white on the inside. So for this mask, the outside is blue, the inside is white. Now, depending upon what mask you have and whether or not you're using a cloth mask, it may be a different color. But you have to make sure that you're putting it on the right way, not backwards. The next thing is to make sure you don't have it upside down. So you see these little pleats? So the pleats should always be facing down, like a cascading waterfall. Okay, that's how you can remember that. If you happen to have this little bendy part up here, that should always also be at the top of the mask. Now, to put on your mask, the first thing you want to do is, if you have this little bendy thing, you want to kind of bend it like that. And then you want to put this over your ears. And then it's hard to do when it's backwards, but okay. So there you go. Now the mask is on nice and snug. Okay, so now I'm going to show you what not to do. Okay, so let's say that you are standing in line at the grocery store buying your groceries, and now somebody sneezes in your direction. Okay, so now they sneezed on you. Your mask did its job and it caught all that yucky, gross coronavirus, right? Okay, so now you're walking along and your face itches. So what do? Start scratching and pretend like this wasn't on my hand, but itchy face. Yuck, I have coronavirus all over my hands now, okay? Now I'm walking along, my phone rings. Hello? Yeah, okay. Yeah, I'll be there later. Look at that. Boom, yucky coronavirus all over my phone. You know what? I'm kind of hungry. I think I'm gonna have a snack. I'm just gonna pull down my mask and snack on this nice lemon. Bam, there's coronavirus all over my nice lemon. Oh, you know what? My face itches. Bam, now I have coronavirus all over my face. So that is what not to do. Now, what you should not do is ever touch your mask when you're wearing it. If, however, for some reason you absolutely have to, just make sure that you immediately wash your hands or use hand sanitizer afterwards. Now, let's say that you're finished wearing your mask, and let's say that you didn't touch it. How you would take it off is not this way, right? You do not touch this. What you want to do is grab it by the straps like that. Bam. And then you want to throw this away in a trash can, or if it's washable and reusable, you can wash it with hot soapy water immediately. And then, importantly, right after you take off your mask, the very next step is to wash your hands, or if you can't, at least use some hand sanitizer. So there you have it, the right and the wrong way to take off a mask. This has been a Free Range Psychiatry production, from our family to yours, sending you love and light.